Very good morning to all of you. Yesterday, we have seen an important topic of homeopathic mathematics, that is science and philosophy of homeopathic mathematics. And in that, we have understood how the various attributes of science is fulfilled by the subject homeopathic mathematics. Mainly, we have seen that there are few attributes of science like few attributes of science like it has certain laws, it has certain regulations, it has certain logic, it has standardized procedure, it has standardized mechanism. The results which are there has to be repeatedly seen under different environment. And the most important is that any science, when we say it is a science, it has to be have its ratio of precision. We have seen all these things, and we have continued with the philosophy of homeopathic mathematics. Now, today we'll focus for a few minutes for this topic of philosophy of homeopathic mathematics. So, why homeopathic mathematics as a philosophy? Because behind that mathematics, there are three important topics which are interlinked with it, and that's why it is called as a homeopathic mathematics has a philosophy. Since the beginning of this lecture, I am also telling you that homeopathic mathematics is not only a mere collection of symptoms under collection of a symptom of a various specific drugs. So there is a philosophy which is beyond these symptoms, and this philosophy of homeopathic mathematics is reflected in these three important points, that this homeopathic mathematics revolves around the basic principle of our organon, like holistic approach, individualization, and dynamism, or its dynamic understanding. Now, the whole homeopathic mathematics revolves around these three important uh, principles, that is holistic approach, individualization, and homeopathic mathematics being a dynamic. Out of these three points, we have yesterday seen one important topic of homeopathic mathematics is based upon the holistic approach. The homeopathic mathematics is based upon the principle of individualization, and we have taken how our homeopathic mathematics is different from the mathematics of other systems in this way of individualization. Other mathematics just record the effect or the qualities or the medicinal properties of a drug substance. But homeopathic mathematics goes beyond it, and it tries to individualize how two drugs are different from each other. And then we have taken example of pulsatilla and chamomilla, that this both these drugs are producing inflammation of ear, but at the level of expression, these two drugs are definitely different. Chamomilla will be very much cranky, irritable, snappish, will not able to tolerate the pain at any cost. That is chamomilla. And on the contrary, the pulsatilla is mild, gentle, weeping without any cause. So this individualization at the level of symptom is very important principle of homeopathic mathematics, and this is also the strength of homeopathic mathematics as compared to the mathematics of other sciences. And it is because of this philosophy of individualization we are able to treat more and more number of patients which are coming from other systems of medicine. So this is the strength of homeopathic materia medica. Now, the one more important point is why or what is the philosophy of homeopathic materia medica is dynamic, and the important point is this. Now, before proceeding further, I I want to just ask you a question. You must be clear in your first year with respect to this concept of dynamic. So dynamic is, I think you understood, which is not material, which cannot be seen under the microscope. Whatsoever a microscope is of a bigger resolution, there is that microscope cannot demonstrate any material that is called as a dynamism, that is called as dynamic. Then that is the meaning of dynamic. And if you just take a review of most of the concepts in our homeopathy, most of the concept of organon on which homeopathy is based, like homeopathic concept of vital force, concept of health, concept of disease, concept of miasm. These are concepts. All concepts are not belonging to the school of materialism, but it belongs to the school of dynamic, school of dynamism. That and our organon explains all these things: vital force, health, disease, miasm, at the dynamic plane, and that is the strength of organon. And also, when it comes to the homeopathic materia medica, it is also the strength of homeopathic materia medica. So, friends, if the concept of health, disease, miasm, concept of vital force, all these are dynamic. Now, the drugs which are used in homeopathy, the drugs which belongs to the subject of homeopathic materia medica, uh, does they should be material or does they should dynamic? It is just a common sense that the dynamic things, the treatment of dynamic things will always require dynamic agents. It will always require the drugs. And accordingly, all of our homeopathic materia medica, which is proved, is based mainly on the dynamization. Now, if we review the history of this homeopathic materia medica, now you must be knowing that how the various principles of homeopathy has evolved. So the theory of drug dynamization has been introduced by Hahnemann in after fourth and after fourth edition or in the fourth edition. So till that time, there was also materia medica. So now I am talking of materia medica before the theory of dynamization and after the theory of drug dynamization. And even before the drug dynamization, there were symptoms in the homeopathic materia medica. But these symptoms were mainly related with toxicological finding, mainly related with poisoning, mainly related with accidental symptoms. So there was not much individualization, that there was no much scope of individualization in the homeopathic materia medica, which was there before the theory of drug dynamization. But after this theory of drug dynamization, the whole scenario of homeopathic materia medica has changed. The symptom has become, the effect of the drugs have become more and more refined. It become more and more subtle. It become more and more expressions of the dynamic vital force or of the dynamic disease, which has been artificially induced by administration of these drugs. And when we compare this to materia medica, obviously the homeopathic materia medica based on the theory of drug dynamization or the homeopathic materia medica, which includes the pathogenetic effects of dynamic drug, is more important and it is found more practical. Now, depending upon this drugs dynamization, in the initial evolution of homeopathic materia medica, there were persons like Richard Hughes. Now, this Richard Hughes has written a few books on the materia medica. He has studied the materia medica with respect to the drug pathogenesis, and he was the person who has said that the homeopathic drug should not be proved beyond 12 potency. And the reason is that we all know that beyond 12 potency or 12 centesimal potency, there is no material present in it. So the Richard Hughes was of the opinion that the homeopathic drugs should not be used beyond the 12 potency. And so accordingly, he has limited his study only to the drugs which are proved below the 12th potency. But later on, as the time has passed, all of them have understood that even the potencies are beyond 12 centesimal potency, even it is 30 potency, 200 potency, the effects are more. The dynamic changes which are happening after the administration of this artificial drug agent, they are more better, and they are giving more symptoms of homeopathic materia medica. For example, now there is a you all know that there is a drug like Carbovage, and this Carbovage is just prepared from charcoal, the vegetable charcoal, and this vegetable charcoal even today it has been used in a various carminicide preparations of modern medicine, and it is a agent which absorbs the gases from the abdomen. So that crude charcoal, nobody thinks it will have certain medicinal properties. But after this theory of drug dynamization, when the dynamized drugs were proved, it has been come to notice that yes, the inert crude substances like vegetable charcoal, when properly dynamized and when it is proved, it also gives rise to more and more number of symptoms, and which indicates the scope of using Carbovage in the diseased individual. So same example goes with the Silicia. Silicia is just a medicine prepared from sand. Before drug dynamization, nobody could feel that the sand will be used as a medicine. So there was one more advantage of this dynamization used in the homeopathic materia medica is that drugs like lachesis. So lachesis is a drug which has been prepared from the poison of Surukuku snake. Nobody would have imagined that somebody is taking that crude poison, but the drug like this crude poisons were potentized and their crude effects were minimized. And then slowly, this lachesis has become a very wonderful drug in a homeopathic materia medica. So just remember this, friends, that homeopathic materia medica in its evolution were also divided between the time before the time period of theory of drug dynamization and after the time period of theory of drug dynamization, and the materia medica evolved after the theory of drug dynamization, after the application of this potentized medicines in the drug proving. It is more better, it is giving more information about the drug pathogenesis. So remember, this is also an important point why the homeopathic materia medica philosophy is also revolving around this dynamic. Then one more point I want to highlight is that whatever the pathogenetic effects which are seen of all these dynamite drugs, the effects are also at the level of dynamic level. They are not being carried out till the development of certain changes at the level of cell, certain changes at the level of tissue. So remember that about drug proving, if you study the experiment of drug proving thoroughly, and there is one point when to stop this drug proving, and it is clearly mentioned that this drug proving has to be stopped before there is a structural alteration, there is a pathological changes seen at the level of cell or tissue. It has to be stopped, and accordingly whatever symptoms are recorded in the homeopathic materia medica, they are all related to the dynamic pathogenetic effects of the drug. So this is the important aspect of the philosophy of homeopathic materia medica, that this philosophy of homeopathic materia medica is also revolving around this dynamism. And because of this three trinities of philosophy of homeopathic materia medica, first that we have seen is the holistic approach, second we have seen is the individualization, and third is the point of or the principle of dynamic nature or the principle of dynamism. The homeopathic materia medica philosophy is more time tested, and it is more different from other schools of homeopathic materia medica.
आपकडे